Ngiphinde ngikwamukele mbukeli lapha ekhaya sisaqhubeka nalo udaba lwethu. Cynthia ubusachaza ukuthi obodokotela they have to go to their work. There's nothing we can do about that. Ungabe ungathini kumbukeli obukele ekhaya who is going through what you have went through?
It's important ukuthi ukhulume if you are in pain or if you've gone through hardship. It's important to get someone and then ukhulume naye, express. It's important to get to psychologist. It's important to get to psychiatrist and get help, because if ungatholi uncedo you die inside. So, and more important futhi nokuthi uphume, you know, be in a certain environment. Other environments, they bring healing to you. And also to choose right friends. Because when your life changes, and the friends needs to change also, because other friends, they won't understand. They will treat you like before. Because manje, if I'm in this stage, my thinking is no longer like before. So I need people that who will understand me. Sometimes that I can budge in anger and they will understand, you know. And that in this stage, I'm fully control, you know. I want to control and manage things by myself. So other people, they don't understand that. So it's important that you get the right people, people that speak life to you, people that don't come and, you know, bring negativity to you, because that also can destroy you. So meaning survive in that manner. So I can advise people to get right people and get help. It's important.
But Zipho, you know kunale myth yokuthi hi why kufanele ngiye ku psychologist, especially thina bebaleli mnyama ukuthi ufeel ukuthi ngiyofika lapha ngixoxa indaba zamathule angibuke. How true is that? I guess it's correct le myth namhlanje.
Khona kuyiqiniso kusekhona abantu ababuka umsebenzi we psychologist nje nama mental health practitioners njengathi umsebenzi ongenasidingo. Abanye futhi babuka ngathi umsebenzi wabantu abamhlophe, babona nje ukuthi ayisikho isidingo sokuthi ngiyothula inkinga zami kumuntu, ayikho into azongisiza ngayo. Ingoba asikakafundiseki really as imphakathi ukuthi kubaluleke kangakanani ukunakekela mental health yakho. Uyazi ukuyothulula nje umthwalo wakho uyokhuluma ubhodla. Maningi ama patient mina ngithi mhlawumbe mangiqala ukwabona umuntu awu ethi uyazi sengizwa umthwalo sewehlile mayiphuma nje ngoba ube nalento ukuthi lento iyamsinda.
Akakwazi ukuyitshela omunye umuntu ngaphandle ngoba futhi abantu mabaxoxela ngaphandle bazothatha le ndaba bazigcwalisa yonke le ndawo lena uphinde kwenze more depression.
So kubalekile impela nje ukuthi abantu bazi ukuthi umsebenzi wethu uyabasiza abantu. Ngeke ngithi mina uma ngenza lesibonelo sokuqeda le stigma with mental health ukuthi uma unenkinga nezinyo lakho uyahamba uye kudokotela wezinyo. Uma imoto yakho inenkinga uyayihambisa uyise ku mechanic. Uma futhi unenkinga emoyeni wakho emphefumulweni wakho uyaya ku psychologist ikusize. So akukho okurong, akukho kubi, akukona ukuthi mhlawumbe ususanganelwa ikhanda. Abaye abantu futhi baye basebenzise igama elithi crazy. Ngeke ngisho mina ngithi sengifunda inqwaba yeminyaka lokungangena e-university angikaze emabhukwini engiwafundayo ngihlangane negama elithi crazy. So ukuthi nje abantu abafundisekile ngomsebenzi, you know, around mental health and mental illness. Kanti uma uhamba uyothola usizo ngempela kuma mental health practitioners uyakwazi ukuthi impilo yakho uphile impilo engcono nempilo enokuqhubekela phambili.
Dr Mothapo, as ribulela ka COVID, the impact on mental health, what other mental health illness have you seen since this during COVID, post COVID? Why again? Yeah.
You know, anxiety and depression.
Okay.
Since the onset, COVID, you know, those are the most common ones that we tend to see. And the triggers. You know, some of the people who, you know, they've been infected with COVID, but they were not even aware.
Okay.
So, but then, you know, they start presenting with depression or anxiety symptoms. So bolwetse bo ba COVID re lemogile gore just the infection e ka bo yona e ka feleletsa e tlisa bolwetse ba anxiety or depression even though you are not aware. So ba bangwe they become anxious because of first of all ne re bona batho ba bantši ga ba ne le bolwetse bo ba tšea ka pela. So there was an uncertainty, because this, we need to have a life that we can predict. But suddenly, our world was turned around. So there was this fear. So that that isolation, it created a lot of psychological problems. People became anxious. Because suddenly they could no longer interact with their friends, family members, and so forth. So rebana anxiety, depression, but rebana what we call neuropsychiatric manifestations is a COVID. So
Okay.
the neurological symptoms, it's they can come from having had an infection with COVID, sort of a cognitive syndrome. Gore batho ba presenta ka di symptoms tsa ke tla re go lebala, lack of energy, lack of motivation, so they suddenly lose interest in things that they used to be interested in, though they are not depressed. So that's one of the syndromes that are born with COVID, and hence it's when this new word it's a long COVID. Where people really struggle to retain back their normal function. They struggle in school, if they were studying, so there's a lot of things that have happened since this infection. I think we still don't understand what type of an illness it is. We're still learning as we go along. We tend to see new things.
Huna le stigma sa hore I don't want to see myself in Akiso, batho ngare ba troya batho mola you lose your mind. Those stigmas. Can we correct those stigmas today? Hore how hona le bolwetse ba mental illness? Stand up and look for help. Can you?
Yeah, I think that's the biggest
Yes.
So I think it goes with belief systems. Some people believe it's a spiritual illness, versus a medical condition. We know that so they are biological illnesses. So people shouldn't say because it has to be treated differently separated from other medical illnesses. It is a medical illness. There is treatment for it, and people do get better.
Okay. Mbukele khaya isikhathi sesidliwe yinja kanti niyazi ukuthi namhlanje bekuyi last episode yethu yaku first season luphela kanjalo uhlelo lwethu namhlanje ninithanda nonke emakhaya nisale kahle.